Good morning and welcome to today's Community Connection. Our topic is what is hospice and palliative care? We are honored to have our own Karen Dessy, who is our clinical educator and a nurse, present today. She educates all of our staff in our community on hospice and palliative care on a regular basis and just does a wonderful job. I'll let her tell you more about who she is and as she gets started in her presentation. Just a reminder that if you have questions, you can enter them into the chat box and we will ask Karen throughout the presentation or at the end. And this video is being recorded. The session is recorded and will be available on our Community Hospice YouTube channel in the near future. So Karen, with that, I'm going to go ahead and pass it off to you.
Thank you so much, Kristen. Well, good morning, everybody. What a pleasure to be with you today. My name is Karen Dessy. As Kristen said, I'm a registered nurse. I've been a nurse now for about 15 years, and I've been with Community Hospice for 10 years, and pretty much have done every position. So I worked out in the field, taking care of my patients and families, and now I'm privileged to have the opportunity to share that knowledge with my staff here and also with our community. So without further ado, we're just going to talk about what is hospice and palliative care. There was a time, that palliative and hospice it was an interchangeable word. Comfort care, hospice, palliative care, they all pretty much meant the same thing. But now, in this day and age, we've actually got two separate identities, one for hospice and one for palliative care. And so we're going to talk a little bit about what each one looks like. Okay. Feel free at any point in time, if you have any questions or concerns or comments, to just interject. I love interaction, so feel free to do that. Thanks. Okay, so who is Community Hospice? Community Hospice is the oldest and largest nonprofit community-based hospice agency caring for thousands of neighbors and friends since 1979. We had these beautiful ladies that founded our hospice in a church attic by two volunteers. They were both registered nurses, and they were noticing that there was a disparity, a gap taking care of those patients in our community that were diagnosed with a terminal illness. And so from the very beginning, Community Hospice has served all people from the Central Valley at all income levels, including the homeless. So we serve our community regardless of their ability to pay. And this is a tradition that we continue to strive to complete as we grow and as our community grows, and we want to meet everyone's needs. So that was a beautiful thing that these beautiful ladies really thought to start here locally for us. We are licensed by the state of California. We are certified by both Medicare, and Medi-Cal. Our accrediting body is CHAP. We are accredited both for hospice and also for palliative care. So we have a lot of entities that allow us to provide services. And then we have very stringent regulations that allow us to keep working and make sure that we provide the best quality care for our community, our patients, and our families. Right here, you see a yellow circle in the middle of this map, and that indicates how far out we are able to provide services. So we provide services 50 miles out from each one of our locations, and we have from Modesto, 50 miles out down to Merced County and to Santa Clara. We go through Tracy, and Tracy falls into our Stockton, San Joaquin area. And so we are able to, from our office in Stockton, reach out to 50 miles from that location as well. So it gives us a really big, broad area that we can serve our community and provide services that are much needed to families when it's time to utilize this. So there are some misconceptions about hospice. Often, as a nurse, when I went out to patients' homes, they would ask when I was moving in or when they could go to hospice. And actually, hospice is not a place. It is really a philosophy of care. And we really focus on a person as a unique whole, and we take into consideration all of their needs. So that's their physical, emotional, spiritual needs, and then we develop a plan of care that is specific to them. So certainly we have nursing staff that goes out to take care of them, but we really want to meet the need for the best quality of life that we can help provide for these patients that come onto our services, as well as their families. How do we get to use hospice? Who qualifies for our services? So the very first thing that we need is somebody to tell us that the patient has a terminal diagnosis, which means that somebody told our patient, our loved one, that they have 6 months or less to live. That's the first criteria. And then the patient has to show some decline in functional status. And what that really means is that they are finding it difficult to do their daily activities. So walking is becoming difficult, being able to cook for themselves or care for themselves, like bathing, brushing their teeth, or doing self-care has become a difficult place for them, a thing for them to do on a regular basis, and they need support. When it talks about being a dependent of 3 out of 6 daily activities, really talks about whether we're able to bathe ourselves, whether we're able to brush our teeth, use the bathroom, dress ourselves, those types of activities that have started to diminish or become difficult for us. We also really look at the ability to eat, or for our body to absorb nutrition. Sometimes our patients have a disease process that we still feel hungry and we eat, but we just don't absorb the food. And so we look at nutritional status in the way of, have we lost any body weight over the last 6 months? Other criteria include if the patient's been to the hospital multiple times, and typically the criteria says more than 3 hospitalizations or visits to the ER. If they are having a decrease in being able to do daily activities, if going to the store has become too much of a physical activity, just standing in the kitchen, washing dishes has become difficult, and whether they've had any decrease in cognitive ability, basically making decisions for themselves, being able to hold an intelligible conversation, and any other comorbidities that might add or help us to determine that terminal diagnosis of 6 months or less per the criteria by CMS guidelines. Okay, so some of our hospice eligible diagnoses are Alzheimer's disease, ALS, cancer, cerebral vascular disease, otherwise known as stroke, and the patient sometimes is in a coma state. We have congestive heart failure or heart disease, HIV, Huntington's disease, liver disease, lung disease, or otherwise known as COPD, multiple sclerosis, muscular dystrophy, Parkinson's disease, and chronic renal failure. So who may be eligible for care? Well, it depends on symptoms, and we'll go over a few of them. Anybody that has uncontrolled or increased pain, increased in shortness of breath, increased in difficulty in breathing, progressive edema or swelling of the body, uncontrolled nausea, vomiting, anybody that might be becoming dependent on oxygen, progressive or sudden weight loss. We could have progressive renal insufficiency or renal failure or kidney failure. Frequent infections, frequent hospitalizations, what the patient has become withdrawn, confused, bedbound recently. They have profound weakness and fatigue and progressive decline despite curative treatment. So we're seeking treatments, they're taking different medications, and none of them are really being effective. And all of these things can contribute to becoming eligible for care. It's not just one or the other. It does take multiple symptoms and signs that help to really define whether you're eligible for hospice services or not. Okay, so The way that we provide care for our families and our, for our patients and our families, here we have an interdisciplinary team, which is the light blue on the outside. Our target is at taking care of our patients. We also have family and friends that remain taking care of their loved one, and we are supportive on the outside. So our interdisciplinary team consists of a medical director, an attending physician, a social worker, a chaplain, possibly volunteer, dietitian, hospice aide, and a registered nurse. And we all work collaboratively together to make sure that we've created that plan of care and take amazing care of our patients. Where is hospice provided? Well, we can provide hospice in almost any setting. It can be provided in a private residence. We could go to a skilled nursing facility, a retirement community. We do provide hospice care, of course, at our Alexander Cohen Hospice House. It's a short-term stay. It is not a long-term facility. So we use it for a respite, or we use it for what we call GIP, which is a general inpatient, and that is for specifically for patients that have symptoms that are so out of control we cannot manage them in any other setting. And the same is true. We also serve our patients in a hospital setting, and generally speaking, but not always, under the GIP level of care, which requires higher level of care, and the patient is unable to transfer or be cared for under any other setting. Sorry, let me go back. So we have a beautiful video of our hospice house, and I'd love to share this with you guys. It's very well done, so I'm going to just hit play and let you guys watch.
At Community Hospice, our goal is to keep patients wherever they call. At times, pain and symptoms may become unmanageable, requiring round-the-clock nursing care. The Community Hospice Alexander Cohen Hospice House specializes in care for patients whose caregivers require short-term respite from home care, as well as patients with symptom management issues requiring more medical attention. The Alexander Cohen Hospice House, located in Houston, California, features 16 private rooms with adjoining patios, a chapel, playrooms for children and teens, and a family kitchen and laundry room. The Community Hospice Alexander Cohen Hospice House provides an option for our patients accommodating 24-hour care in a comfortable, home-like setting. The grounds include meandering paths that lead past serene water features, a rose promenade, and meditation areas. Admission to the Community Hospice Alexander Cohen Hospice House is based on physician approval, available space, and patient needs, and depends on whether symptoms can be managed at home or if a caregiver is available. Our goal is to manage patient symptoms, meet family needs, and, if able, assist our patients with returning to their physical residence, where Community Hospice will continue to provide services.
Okay, that was wonderful. It is a beautiful facility. If you ever just want to go out and maybe take a tour at some point, you can call and ask if that's something that is available to you. Otherwise, this will be posted online so you can get a firsthand view of what the hospice house looks like. Because of COVID, there are quite a few restrictions. So, but if you should ever have the opportunity, I hope you get to go out and see it in person. So some common myths about hospice services, and there are many out there, but here are a few of those that really stand out. And one of those are that we can no longer see your primary care physician. And really, community hospice works really closely with your primary care physician or specialist to develop the best individualized plan of care. Patients can also continue to seek advice and treatment for any issues that are not related to their hospice diagnosis. Not all physicians follow patients once they are on hospice services because it is a specialty, but they still like to keep track of what's happening. So we do communicate well with them and make sure that they know how far along patients have gotten, what treatments we're providing for them. So they are always kept in the loop. And again, you are able to see them as if you are still able to do so, or if they choose to come and make a home visit to you. We don't restrict that. You should build a good rapport with them. And so we understand that you want to go out and see them too. A patient cannot go to the hospital. So as much as we say, that you're on hospice services, the majority of people on hospice services want to stay at home and they want to be surrounded by their family and their loved ones rather than be in a clinical setting like a hospital. Patients always have the right to seek treatment in a hospital setting. And if a patient decides that they want to go to the hospital for diagnostic studies and treatment, they can absolutely stop hospice services and request hospice once the time is right for them again. Coming onto hospice services is not set in stone. You sign a piece of paper to come on and agree to our services, and you just sign a piece of paper if you feel that you would like to seek other treatments as well. During hospice stay, if there is a need for you to go to the hospital, we absolutely will make sure that you get the treatment that you need. Okay, so there's never a restriction on the services that you're able to have unless it goes against the regulations that are set for us. That you must have a do not resuscitate or a DNR. Community service, we definitely honor a patient's right to choose between receiving resuscitative care and a do not resuscitate. And our goal is to provide education and emotional support to empower our patients and families to make their decision that would be right for them. It is not a requirement for you to have a DNR when you start services, okay? All right, so now we've talked a little bit about hospice. We'll do a quick overview of what palliative care looks like, and it is a community-based palliative care program. And community-based palliative care program is specialized medical care for people with a serious illness. So hospice is for those with a terminal diagnosis with 6 months or less. Palliative care is specifically for patients with a serious illness. And palliative care focuses on providing relief from the symptoms and stress of a serious illness. And the goal is to improve quality of life for both the patient and for the family. So the progression of illness, this is a quick overview. Often people get diagnosed with a disease. And as they do, having palliative on board at the same time really helps them to navigate through the healthcare system, receive the treatments that they need until there comes to a point where you may need hospice services, and palliative care and your physician that you're working with will then refer you to hospice. If you choose hospice, you may absolutely come onto services if you qualify. And then, of course, with hospice, we provide bereavement services after we have lost our patients. Some core principles about palliative care. It is a specialized medical care for people with serious illnesses. We work on relieving pain, stress, and other symptoms that can happen at any stage of the illness. Palliative care can be provided along with treatments such as home health. Patients can still seek out physical therapy, occupational therapy, chemotherapy, or radiation therapy. Palliative care is a program that helps to navigate all of those therapies, and there's no restrictions. And they will also help to communicate well between your physicians and your doctor's appointments. That way, everyone's on the same page, and it takes the stress off a little bit too. Serious illness can be very life-changing. It can impair function and interferes with normal activities of daily living. It certainly has a high risk for decline and cause frailty in your everyday life and your body as it's progressing in your disease process. And they're most likely to have what is considered non-beneficial care in the last year of their life. So we're seeking lots of curative treatment, but that doesn't really affect your body in the way that we want to cure any of the diseases. It's just helping to palliate and keep you comfortable and progress forward. Ability to care for yourself or others is affected. And of course, there's a lot of caregiver burnout and burden that if you are the person with a serious illness or if you are caring for the person with a serious illness, certainly there's a lot of burden that comes along with that. And palliative care wants to help meet all your needs in every one of these areas. Some general criteria as to how you can qualify for palliative care. Palliative care patients likely are use the hospital or the emergency department when they have advancing disease processes to help manage those symptoms. Often what happens is you get a severe pain and you go to the ED, and it's typical of everybody with a serious illness that you have certain crises that happen. As an advanced illness is defined or in the disease process and specific criteria. If you've been to the hospital, your insurance is aware of it, your physicians are aware of it, and they may direct you to palliative care to help manage those things. Death in 1 year would not be unexpected because of the progression of your disease. And it's definitely not a time where your disease is reversible. Attempt to provide appropriate in-home disease management may have failed, and then you want to participate in advanced care planning decisions. And that's something that palliative care does a lot of work in that area, just to see what is it that you're looking to do in the future and how would you like to progress as the disease is progressing as well. Palliative care can provide an extra layer of support that might look like psychosocial support, understanding of the condition or the disease process you have, how we can help provide comfort and spiritual support for you, and determine goals of care. And again, that advanced care planning is really important for everyone to understand what your needs are and how you would like to move forward as your disease is progressing. Some of the people that are involved in taking care of you while you are on palliative care, our community care choices team includes nurses, social workers, a medical director, a chaplain, community-based chaplain, and then we help with accessing other resources such as durable medical equipment, helping to set up appointments with physicians or specialties, and then any other community resource that you may need, we will help to navigate through and help you get those resources. We can provide palliative care in many settings, very similar to that of hospice. We can provide palliative care in a private home, in a residential care facility, in a skilled nursing facility, in a clinic setting, and then care is also based as need and acuity allows, either through personal visits or through phone calls. And then hospice grief support services. We are so blessed to have so many wonderful people that work to help provide caregiver support. We can do telephone support. We can do this kind of grief support through mailings, or we can do it through crisis responses. So if you've had a crisis and you need support, we have a team that can help you get through a crisis. And again, it can be through a phone call, it can be through mailings. Sometimes we'll make appointments one-on-one or as a group. But then you would have to call and reach out and we would set that up for you. There are others that we can do, just as we said, individual group supports, grief support groups. And we also offer educational workshops, and we have a resource library here as well. So This is the end of our presentation, and Kristen will talk a little bit about other resources we have for seniors and veterans in our San Sauce County coming up March 23rd, and she's amazing at setting these things up. I thank you so much for your time. I'm still online. I'll let Kristen take over, but if you have any questions or concerns or comments, please feel free to just jump in or use your chat. Okay, thanks so much, everyone.
Thank you, Karen. Karen, I do have a question for you. So if somebody utilizes hospice services and they decide that they want to go seek some additional measures or treatments, can they come back onto hospice services, or is it just a one-time program?
No, absolutely. So hospice, excuse me, you can come onto hospice services and see that you have a treatment that you would like to pursue. And you can certainly sign off to pursue that. We would never want anybody to ever feel that they're restricted as to the treatments that they can get. Once you have sought out those treatments, if you never need us again, yay for you, good for you, we're excited. Should you ever need us ever again, we'll be right here, and you can sign back onto our services at any point in time, and we'll be happy to take care of you if needed.
Wonderful. And have we, or have you experienced any patients that have come onto hospice who have improved and then graduated into just the palliative care program?
Oh my goodness, at least 4 people that I can think of have graduated off of hospice services and have lived wonderful full lives after they've been with us, with just a few tweaks and medications and different things that we've helped them with, and just improve their quality of life, and they've graduated off of services. It's a wonderful thing to experience.
That's awesome.
Absolutely.
Awesome. Well, I don't see any other questions. So Karen, I just want to thank you for taking your time to share these great resources with us. I think we all know somebody that could utilize palliative or hospice support who has a serious or an advanced illness. So it's always great to have these resources. I encourage you all, if you need additional resources, to reach out to Community Hospice. Our phone number is 209-578-6300, and we're happy to walk you, a family, a friend through any steps of learning more about our programs and services. We'd also like to encourage you to join us for our next presentation, which will be on March the 23rd, same time at 12 o'clock. You can use the same login information, and that topic is resources for seniors and veterans in Stanislaus County, which is also much needed for all of our veterans in our community. So with that, we're going to go ahead and end our presentation for today. Remember, this will be available on our Community Hospice YouTube channel if you'd like to see it again or share it with your peers. And we thank you for joining us.
Thank you, everybody. Take care. Okay.